Healing childhood trauma. Recognize the signs and symptoms. Abandonment wounds can manifest in a variety of ways, both emotionally and behaviorally. Some common signs include chronic feelings of loneliness and isolation. Identify the root cause. Abandonment wounds often stem from early childhood experiences such as colon. Explore the impact on your life. Abandonment wounds can have a profound impact on our sense of self, our relationships, and our overall well-being. By understanding the root cause of our wounds, we can begin to see how they are influencing our current behavior and make choices that are more aligned with our values. Allow yourself to feel your emotions. It is important to give ourselves permission to feel the pain, anger, sadness, and grief that are associated with abandonment. Trying to suppress these emotions will only prolong the healing process. Practice self-compassion. Talk to yourself the way you would talk to a friend who's going through a difficult time. Be understanding and forgiving of yourself. Build a strong support system. Surround yourself with people who love and care about you. These people can provide you with the emotional support you need as you heal. Seek professional help. If you're struggling to cope with abandonment wounds on your own, consider talking to a therapist or counselor. A therapist can help you understand your wounds and develop healthy coping mechanisms. Remember, healing is a journey, not a destination. It takes time and effort to heal from abandonment wounds. Be patient with yourself and celebrate your progress along the way. Here are some additional tips for healing abandonment wounds: Journal about your experiences. Writing about your experiences can help you to process your emotions and gain a deeper understanding of your wounds. Engage in activities that make you feel good. When we do things that we enjoy, it releases endorphins that can improve our mood and reduce stress. Practice mindfulness. Mindfulness involves paying attention to the present moment without judgment. This can help us to become more aware of our thoughts and feelings and to let go of negative thoughts and patterns. Connect with your inner child. Our inner child is the part of us that holds onto our pain, and by connecting with our inner child, we can provide them with the love and comfort they need to heal. Healing abandonment wounds is a challenging but rewarding process. By taking the time to uncover and heal your wounds, you can build a more fulfilling and joyful life. Complex post-traumatic stress disorder (CPTSD). Childhood trauma can have long-lasting and severe repercussions on an adult's life if left unaddressed. Here are some interesting points and synopses of popular articles on healing childhood trauma: 1. SAMHSA provides an infographic that helps recognize the signs of child traumatic stress and the impact that trauma may have on children. 2. SAMHSA explains that childhood traumatic stress occurs when violent or dangerous events overwhelm a child's or adolescent's ability to cope. Traumatic events may include neglect, psychological, physical, or sexual abuse, natural disasters, terrorism, and community and school violence. Witnessing or experiencing intimate partner violence, commercial sexual exploitation, serious accidents, life-threatening illness, or sudden or violent loss of a loved one. Effective treatments like trauma-focused cognitive behavioral therapies are available. 3. Mental Health Center explains that childhood trauma can manifest in many ways and can affect adult relationships in many ways. Several factors may determine how a child reacts to trauma. These include the child's age, developmental level, the severity of the trauma, the duration of the trauma, the proximity to the trauma, and the relationship to the perpetrator. The repercussions of childhood trauma are complex and varied, heavily influenced by the specific trauma and individual characteristics of the child. Therapy techniques for healing are also discussed. 4. Choosing therapy explains that healing from childhood trauma can be incredibly confusing because children struggle to interpret events, contexts, and emotions. There is not a set or scripted way to heal from childhood trauma, as everyone's experience is different. However, there are specific steps and experiences of healing childhood trauma that are common to most people who decide to do this work. One of the largest ways childhood trauma can affect your current life is your ability to value yourself, self-advocate, and to trust yourself for others. 5. Medical News Today explains that childhood trauma can lead to a sense of worthlessness, shame, and guilt in children. Children may blame themselves for the trauma or feel powerless and helpless. Childhood trauma may affect emotional and mental processes in the brain. Children may have difficulty problem-solving, planning, learning new information, and reasoning effectively. Support is available for adults who experience trauma in childhood. Treatments and management strategies for adults who experience childhood trauma include psychotherapy, such as trauma-focused cognitive behavioral therapy (CBT), 6. Hindustan Times explains that childhood trauma victims often act as if the event never happened or blame themselves, which can lead to negative impacts on their relationships, careers, happiness, health, etc., until they process their emotions and heal by feeling them. Childhood trauma can be caused by anything that makes a child feel helpless or unsafe. Dr. Melanie Saba, psychologist and chairman of the Anning Foundation, discusses 5 methods for overcoming childhood trauma as an adult, including recognizing and reclaiming authority, acknowledging and accepting the trauma, and being gentle with oneself.